The Delta State government has called for synergy from stakeholders towards the control, prevention, and elimination of neglected tropical disease in the state and Nigeria in general. The State Commissioner for Health, Dr. Onojaime Joseph, who made a call at a press conference to commemorate the 2024 World NTD Day, said most of the medication for the treatment and control of the diseases have been provided free of charge by the state in collaboration with development partners. Dr. Onojaime said NTDs affect largely people of low socio-economic status, particularly in the tropics. He revealed that over 1.6 billion people living in the poorest and most marginalized communities worldwide were affected, resulting in low productivity. Dr. Onojaime noted that the state government was keeping up with the global target of eliminating the NTDs through mass administration of medicines, orientation of communities on NTDs programs, supporting institutional research to determine the prevalence of the NTDs in the state, and pave the way for a greater reach of persons living with the diseases. He said the theme for this year's NTDs Day, Unite, Act and Eliminate NTDs, through awareness and sensitization, was aimed at educating the populace about the NTDs, the strides in reducing the burden of the diseases, and also to call for a collective action towards eradicating them. He called on debtors to avail themselves of the NTDs control and elimination services provided through the State Primary Healthcare Development Agency by visiting the nearest primary healthcare centers and community-directed drugs distributors, as the services are safe and free.
I therefore call on all of us, civil society, advocates, community and religious leaders, corporate organizations, global health experts, and government to be unified in action towards addressing the challenges of neglected tropical diseases. Together we can revert the trend of these neglected tropical diseases, improve the standard of living of our people, and make data great.
The State Commissioner for Basic and Secondary Education, Mrs. Rose Ezewu, pledged support to the Ministry of Health to ensure that students and pupils did not suffer from challenges the NTDs may cause to them in future.
My ministry has the secondary education. Education will take care of the children. The Ministry of Health collaborates with us in terms of immunization and other things to our pupils. So today, for bringing out this NTD Day, I think it's awareness to parents and to everybody in the state.
The Executive Director of the Delta State Primary Healthcare Development Agency and others in an interview highlighted the importance of the NTDs and called on the state government not to relent in its support for the elimination of the NTDs.
For this neglected tropical disease, we have adopted what we call the bottom-up approach, we call community-directed distribution. And so we have community representatives, we have trained, we have also given them the right materials and they work closely with them.
Government is trying, but we are still employing them to do more so that in unity of purpose, these diseases can be eliminated. The disease, we just see them as being neglected for no reason, because they don't kill, they are debilitated. When they disfigure you, no remedy.
So that they go to their communities to do household mapping. And year in, year out, we give them drugs for them to go and meet the people in their doorsteps. Those are some of the measures we carry out in addition to community dialogues and all of that, so that we don't have circumstances of refusals.
So we really want to do, although Delta State has been said to be not to be endemic, but with these cases we are seeing with clinical manifestations, we want to do post-endemicity surveillance research. That's our area. So we hope that with our research findings, we'll be able to tell the government and we'll be able to look at some control measures.
It's a good thing that there is adequate mobilization today for us to know that we in the health sectors, whether doctors, whether nurses, pharmacists, all category of health workers, and then the general populace, all hands must be on deck to make sure that this disease is eradicated.